My name is Carter Lewis, and I attend Wayne School of Engineering.
Hi, my name is Isaac Carino, and I'm a rising senior at Wayne School of Engineering.
My name is Raleigh Benson. I go to Wayne Country Day School. I'm 17 years old, and I'm a junior.
So my topic this year was concerning ACEs, or Adverse Childhood Experiences.
I wrote about the struggle to access healthcare in Wayne County and North Carolina abroad.
Coal ash and hog waste farms that's been affecting Wayne County negatively.
One thing that stuck out to me is just how common that these adverse childhood experiences are. The CDC found that 3 in 5 adults have experienced at least some sort of ACE, and these can be abuse, neglect, an absent parent, and it really just shows you how wide-ranging this issue is.
Well, it's interesting that 14% of residents in Wayne County do not have health insurance, and approximately 1 million North Carolinians do not have health insurance. But what's even worse is that the United States spends more on health insurance and healthcare than any other nation, yet we have the highest disparities in socioeconomic issues that prevents everyone from accessing health insurance and healthcare.
I found that Duke Energy, they were reburning coal ash, like from coal before, reburning it, so that would cause more negative influence on people in that surrounding area, all the coal ash going in the air and they're breathing that stuff in. And the hog waste farms, I found out there's like 4,000 of those in North Carolina, a whole ton of them. And those are, they're gross, but yeah, not that good.
Some of the solutions are very broad and some are very specific. One of them is empowering parents and trying to improve socioeconomic status. These can also include offering opportunities to children to get connected and form communities, even if their family bonds may not always be intact. These give children resiliency to overcome their ACEs as they grow up.
In my essay, I outlined 3 solutions. Firstly, Medicaid expansion. Secondly, increasing healthcare education and healthcare literacy, and revitalizing and redefining the culture of healthcare. The first one, Medicaid expansion, has been proposed time after time by North Carolina's governor, but has been struck down in the state legislature. But it would increase healthcare for 600,000 North Carolinians. That's not a number that you can gloss over, meaning that 600,000 people would now have health insurance, and it would close the Medicaid gap. With that would be fully paid for by the federal government. As for the second one of increasing education, that starts with governments and physicians and patients. We see a lot of disparities when patients and their doctors do not understand each other, and that's where the disparities come from. And as for revitalizing and redefining the culture of healthcare, that comes from trying to stay away from a profit-driven environment and move more towards a patient-driven environment. That is what matters, and that's how we revitalize and redefine the culture of healthcare.
Obviously, you can reduce the amount of coal ash burned at Duke Energy, and of course the hog farms too. But more specifically on the coal ash, you can turn to more environmentally friendly alternatives such as wind turbines, which go on wind power, which is an infinite power source and it doesn't negatively affect people in the surrounding areas.
Well, it's a great opportunity for students to develop their essay writing skills. You also get to find real issues that are impacting your community, and not only do you write about them, but you also get to encourage solutions to be put forward to the Board of Health, and sometimes you can see these solutions being implemented.
Well, the essay contest is just a great way to voice your opinion as a teenager in the county and let the Wayne County Board of Health know that you also see the issues, that you have a perception of the issues, and that you have ideas too. And it's a great way to just show who you are and let them know that you also have opinions and also voice your concerns and solutions. You can actively help change the society that we live in.
It'll broaden your horizons about the health of your community, and it's a good way to raise money for college later on in life.